COVID-19 Self-Isolation Support Pack. A guide to help you through your self-isolation period. I've been told to self-isolate. What do I need to do? Self-isolation is when you do not leave your home because you have or might have coronavirus. If you've been asked to self-isolate, your 10-day isolation will start either the day your symptoms started or the day of the test if you had no symptoms, for both those who have tested positive and their household members. The day you were last in contact with the person who tested positive for coronavirus, for close contacts outside the household, if you were isolating as a contact of someone who tested positive and then you developed symptoms yourself, your 10-day isolation period needs to restart from the day you get symptoms. If you live with other people and anyone in your household tests positive, everyone has to self-isolate and follow this guidance. A person who tests positive should isolate for 10 days and stay in their room and self-isolate from the rest of the household. Use their own bathroom and towels and clean after each use. Use the kitchen separately, eat in their own room and wash their own cutlery and crockery. Other members of the household should self-isolate at home for 10 days, even if they have a negative test result. Keep separate from the infected person. If you must share spaces, create a rota to minimize time together. Why is self-isolation important? Around 1 in 5 people have been in close contact with someone with the virus will get COVID-19 themselves. It can take up to 10 days for symptoms to appear. However, people can pass on the virus even if they don't have symptoms. By self-isolating, you are protecting your community and those most vulnerable. If you need support during the isolation period, Birmingham City Council's Emergency Response Hub can help you. If you are asked to self-isolate, you must do by law. If you do not, you could be fined. So, you do not go to work, school or public places. Do not go on public transport or use taxis. Do not go out to get food and medicine. Do not have visitors in your home, including friends and family, except for people who are providing essential care. Do not go out to exercise unless with your own private garden. Stay-at-home checklist and support. Self-isolation means you cannot leave your house for 10 days. If you need help, Birmingham City Council can support you at any point. Here's a handy checklist of items to think about. My isolation checklist. Food deliveries. Help to get online. Prescription medication. Help with utilities. Topping up energy meters. Posting mail. Caring of pets. Someone to walk my dog. financial support, self-isolation support payments. I have arrangements in place to support my well-being. Friends, families or co-workers I can connect with. Know where to access support if I feel lonely, anxious or overwhelmed or need specific help. Options if you need help with any of these. Birmingham City Council Emergency Response Hub is here to help. You can call us on the number provided, Monday to Friday, 9 till 5 p.m. Number is 0121 303 116. The Emergency Response Hub could offer you support with food parcels, signpost you to local services such as NHS responders, the Active Wellbeing Society. You may be eligible for financial support. To apply, contact Birmingham City Council on the phone number provided, or you can go on the website birmingham.gov.uk/test and trace payment. If you are struggling with your mental health, please call 0121 262 3555. If you're under 25, call 0207 841 4470 and speak with Forward Thinking. If you're concerned about domestic abuse, call Birmingham and Solihull Women's Aid on 0808 800 0028. Top tips for building resilience whilst at home. A number of things have been shown to promote health and well-being and promote positive mental health. Have a routine. Develop a new daily routine that works for you. This can include regular wake-up and bedtimes, planned meal times, and time to be physically active. Stay relaxed. Find a relaxation or meditation practice that works for you and practice it once a day for at least 10 minutes. Keep occupied. Continue with your current interests or explore new ones. You could try a hobby that you used to enjoy but haven't had time for. Ten-day stay at home plan. Day 0. This is the day that you either developed symptoms, had a positive test, were in close contact with someone who has the virus, or someone you live with developed symptoms. Day 1. Planning your stay at home. Your first day at home. Being prepared can help your isolation period run more smoothly. Have you thought about planning everything you might need to stay safe at home for the next 10 days? See page 4 for details on how you can get support with your isolation. 1 in 3 people who have had the virus have no symptoms. However, if you feel unwell, it can help to get lots of rest, drink plenty of fluids, water is best, take paracetamol or ibuprofen if you feel uncomfortable. If your symptoms get worse and you are not sure what to do, please call your GP or 111 for support. Day 2. Financial support. 9 days to go. Thank you for doing your bit in keeping people safe. If you are self-isolating and you cannot work from home during this period, you may be eligible for a self-isolation support payment of up to £500. To apply for this payment, please contact Birmingham City Council on the phone number provided or www.birmingham.gov.uk/test and trace payment. Day 3. Looking after your mental well-being. 8 days left to go. Remember that every day you stay at home helps to reduce the risk of infection for those in your community. Self-isolation can be a worrying time, so don't forget to look after your mental well-being. Research has shown that people who are more aware of sensations, thoughts, and feelings have enhanced mental well-being. This is also known as mindfulness. Have you taken a moment to truly focus on yourself today? How about taking some time to learn some mindfulness techniques? You can find some information here. pocketmindfulness.com. Just look at the website there. For more services, if you're under 25 in Birmingham, we have Forward Thinking, and the phone number is there provided. If you're over 18, you have Birmingham and Solihull Urgent Mental Health Helpline. Again, phone numbers there. The Samaritans, Birmingham Mind on the phone number. And if you're over 70, you have the Birmingham City Council Emergency Response Hub. Again, the phone number's there. And Age UK, and contact telephone number is there. Day 4. Keeping active. 7 days left to go. Just 1 week left of your isolation. Movement can really help to boost your mood, especially when you are stuck indoors. Think about all the inventive ways you can move your body, such as dancing to your favourite song. Local Birmingham partners such as the Active Wellbeing Society, Tours, and Sport Birmingham can provide lots of suggestions to help you stay active at home. You can visit their website, tours.co.uk, activities/virtual wellbeing, or Sport England on their website. For more activities to keep children active, the Change for Life website has a range of 10-minute shake-ups involving Disney characters to choose from. If you want to look at their website, www.nhs.uk Change for Life/activities/indoor activities. If you're isolating because you have the virus, you might not feel like doing much, but try to keep moving if you can. Day 5. Keeping in touch. 6 days left to go. Staying in contact with people is really important for your well-being. Have you connected with friends, family, or colleagues since you've started your isolation? How about reaching out to someone to tell them how you're getting on? There are lots of people who are using social media during their self-isolation period to reach out to others who are staying at home. Is there a self-isolation Facebook group in your local community where people are sharing tips? Day 6. Keeping hydrated. 5 days left to go. You're over halfway there. Keeping hydrated is especially important when you're ill or fighting off infection. Water is a healthy and cheap choice for quenching your thirst at any time. It has no calories and contains no sugar that can damage your teeth. There's more information on the website provided, NHS livewell/eatwell/water-drinks-nutrition. Day 7. Eating well. 4 days left to go. Thank you for continuing to do your bit. Don't forget to nourish your body during this time, even if your appetite is different to normal. What meals and snacks are you planning today? You may still be working from home during your isolation, but there are plenty of easy meal ideas to try. Why not look through a cookbook or make something new? Cooking can also be a great activity to teach children something new and keep them entertained. Healthy Brum YouTube channel is available here. You can look on Food for Fact for Life website or the NHS website. Food Fact for Life. Lots of people will be struggling with their finances at the time, but it's easier than you think to eat well on a low budget. Try these top tips. There's a website that can be accessed, nhs/livewell/eat well/20 tips to eat well for less. Day 8. Keep an eye on your alcohol intake. 3 days left to go. Well done, you're nearly there. We know that for some people it's all too easy to fall into the trap of drinking alcohol regularly at home and when you're in self-isolation. Have you noticed your alcohol intake go up? There's tips for 1U website should be helpful. NHS/1U for your body/drink less. Day 9. Stay positive. 2 days left. Thank you for doing your bit and keeping people safe. You might be starting to feel more motivated with only a few more days of isolation left, but it can be hard to stay positive during these challenging times. Let's change our way of thinking and challenge those negative thoughts. Write down 5 things you are grateful for today. Day 10. Last day. Last day of isolation. Well done preserving and helping to protect your community. What are you planning to do when you leave isolation? Day 11. You can go out. Well done. You have finished your 10 days of self-isolation. Thank you for your commitment and helping keep others safe. Children and coronavirus. What is coronavirus? Coronavirus, or COVID-19, is probably making you feel a bit sad and different at the moment. But that's okay, because everyone is feeling the same. COVID-19 is an illness that can affect people's breathing and lungs. It can be passed from person to person through coughing or touching, which is why we have to stay away from our friends and family just for now. Luckily, young people aren't really getting too ill, but you can still spread it without knowing you have. So, still need to do the amazing things you're doing by following the rules and wearing a mask. How can I stop the spread? The government is asking you to think about hands, face, space. What this means is that you need to remember to do 3 things to keep yourself and others safe. Hands. Remember to wash or sanitize your hands regularly for 20 seconds. Why don't you use to sing your favourite song to make the time pass quicker? Face. Cover your face with a mask when you're out at the shops. Why not get creative and make your mask colourful by adding your own design? Space. Stay at least 2 metres away from people when you can. If you don't think you know how far that is, ask an adult and think about the length of a horse. Why am I worried? It's normal to be worried, but there's no need to worry too much. Everything's a little bit weird at the minute, isn't it? This won't last forever, and the feeling of worried is one that tells our bodies to remind us to take care of ourselves. There are some important things that we all need to do to stay safe, like washing our hands, wearing a face mask when told to, staying at home if we are told to. If you're stuck at home for now and helping to keep each other safe, we can still enjoy life and do some fun things. COVID-19 capsules. Why not have a go at making your own time capsule with your family? You could draw pictures, write a letter, take some photographs, put them all together in a scrapbook or a lunchbox and store it somewhere, like a loft, where you'll come across it years later. You can download some free resources to help get started at the website provided. Being safe at home. Most children are safe at home, but we know that some are not. If your school is closed and you're not feeling safe at home, here are some people that you can call. Childline.org on the number provided, or in an emergency, you can always call the police on 999. How can I help if my family are isolating? Self-isolating is hard and boring, but you're not alone. It's the same for your family too. Here are 2 handy hints for things you can do to cheer them up. Members of your household might feel poorly and need a rest if they have the virus. Why not offer to do the tidying and washing to give them a break? Keep them smiling, learn some jokes or dances and keep everyone entertained. What can I do to have some fun? Staying at home isn't fun and we know that. It can get really boring, but now there's no excuse for you not to do your homework. Once you've done that, here are some fun ideas for you to think about when you're spending time at home. Play some games. Have you tried any of the Disney Shake-Up games? Look at the website for more information. Fun fact, David Beckham used to practice with a tennis ball as well as a football. Do some drawing. If you're feeling worried, sad or lonely, a great way to get your emotions down is to draw how you're feeling and create a colourful picture to help you feel happier. You should always speak to someone if you feel that way, and adults will understand. Set up a virtual chat with your friends. Why not catch up with friends on a video call so that you can feel better and know they haven't gone anywhere? Remember to check with an adult before you do this. There is lots more that you can do, but these are just to get you thinking and help you get creative.